Brilliant, thank you. All right, hopefully quite a lot of what I'll say will reflect and underline those themes. One of the things I wanted to say, though, to anybody that has had CBT and it hasn't been effective, or indeed has heard of people that have had CBT and it hasn't been effective, is I really want to make a call to action to have a fresh start. When I first started out in our very first research project on BDD, which was in fact 20 years ago, one of the interesting things going around different hospitals and telling people about doing a research trial in treating BDD, one of the things we heard quite a lot was, I don't know why you're bothering, you can't help those people. And it's been extraordinarily difficult to overpower that unrelenting sense of negativity around overcoming BDD. So it's not just people who have BDD that have a pessimistic view of recovery. It has been clinicians, GPs, psychiatrists, therapists, have all been contaminated by this idea that BDD is particularly problematic and particularly difficult to treat, and maybe even that you can't. I'm here to say, please don't believe that hype. People do make good recoveries from BDD, as Catherine Phillips was showing earlier on. The fact that BDD may be a stubborn problem to shift does not mean it is an impossible problem to shift. I think one of the kindest things that David Veal has ever said about me as a therapist to a client of mine was, go and see Rob, he won't give up. And it's in this unique way in which my persistently stubborn streak actually turns out to be quite useful to me. Anyone else that knows me will tell you that it's not a good thing in many other respects. So the key thing, as was already heard, is to try and think, can we reconsider the problem? Is it, and we'll talk a bit more about this in a moment, is it theory A, which is that you have an appearance problem, or is it theory B, which is that it's a problem of being overly preoccupied and worried about your appearance? And there's only really one way to find out. No amount of debating, persuading, cajoling will persuade anybody with BDD that they have a psychological problem. The best way of seeing that is to try it out and see what happens. And the curiosity, one of the dilemmas about recovering from BDD and treating BDD is that people are most convinced they had a psychological problem when the problem was gone. Because, of course, BDD, by definition, makes you think that you're ugly and repulsive and disgusting and rejectable. So, in a way, what you're going to have to do, if you're going to make a good fist of having a crack at CBT, is to try and suspend your judgment about your appearance for a period of time. Almost work on the assumption that your appearanceometer is broken, that it can't quite be trusted at this point. It's maybe been overloaded, overworked, overstressed, and it's no longer functioning. Your ability to see your own appearance objectively is temporarily faulting. So one of the things we suggest you do is try and set aside a period of time. It may need to be 2 or 3 months at least to set aside a period of time to really give treatment a proper crack of the whip. So put a date in your diary, just about when you might come back to reconsidering whether you have an ugliness problem or a psychological problem, and meanwhile give yourself a chance to really see. Again, it's always great when your colleagues steal your thunder a bit, but Catherine also was saying that you want to think about CBT as a kind of brain training, almost like a mental fitness program, and that is an excellent way of looking at CBT. We are really the sort of physiotherapists of the mind. CBT therapists should not be sitting there waxing lyrical about the philosophizing and so on of life. We should be helping people to retrain their behavior and retrain their minds. And the kind of targets you're looking to change in overcoming BDD are trying to target reducing the amount of time you spend thinking about your appearance. BDD, by definition, is a preoccupation problem. One of the dilemmas of calling BDD imagined ugliness is it tends to focus the mind a bit on trying to correct the perception of one's appearance. But that tends only to come later. Again, you'll only tend to really feel that you look okay once your BDD is gone. it'd be really great if we could find some mechanism where we could suddenly make you feel like you looked okay, and then your BDD would collapse, but that's not really how it works. So target trying to get the hours a day down, trying to get the steal minutes away from your preoccupation with your appearance. Again, trying to stop checking and fixing your appearance, reducing checking in the mirror, other reflective surfaces, trying to stop hiding, covering up and camouflaging, trying to stop comparing, and trying to reclaim your life, getting back into various situations, connecting with people again, getting back to work, school, reconnecting with your family, socialising and so on. And again, one of the things that Catherine Phillips was mentioning was the persistent critical thoughts that you experience in BDD, and I'll talk a little bit about what to do about those, but the main message in some ways is don't listen. It's a tough journey. People with BDD are suffering a great deal, and they've got a difficult road ahead often. So these are some thoughts I've had about things that might help along the way. Something that a lot of people find very helpful is to think of a metaphor, an image, a way of separating their BDD from themselves. That devil on the shoulder that was mentioned earlier on. Change is uncomfortable. Even with the best of medications and the best of psychological treatments, you're going to need to be willing to experience some discomfort, and perversely, if you're willing to experience it, if you see anxiety, discomfort, maybe even a little bit of feeling slightly ashamed of yourself as you're pushing yourself back into social situations, trying to see those emotions as an opportunity, seeing them that you're actually working in the right zone, that things are moving. Be patient and persistent. In many ways, recovering from BDD, I think, is a bit like push starting a car. When you push start a car, it takes colossal effort to get it moving for those first few inches, and then for that first foot or two. But once you get things moving, you can start to get a bit of momentum, and then it feels like actually this car maybe isn't that heavy. And that's how BDD works. The first 20% and in some ways the last 20% are the most difficult. First 20% is difficult because you're overriding such powerful concerns, such powerful emotions. And the last 20% can be tricky sometimes because you're feeling so much better and life is actually pretty good. Your therapist wants you to just cut back a little bit more on your makeup, or just cut back that little bit more on mirror use, or just confront those last few social situations, and we're trying really hard to get rid of all of the person's BDD, and the person quite rightly is looking back at us and saying, well, life is pretty good actually. I don't really know why you're making such a fuss about it. So the last 20% can be difficult to get rid of. It's worth doing it because it's a bit like pulling up a weed. You want to get rid of it by the roots and get every last trace and so on. But also along that road, be kind, be compassionate. And being kind doesn't mean letting yourself off the hook and being necessarily gentle with yourself. Being kind can mean being quite firm. It can mean really saying, well, this is in my best interest. It's really important I go drop these safety behaviours, I confront these situations, because that's in my best interest. That's the kindest thing I can do, is help myself to overcome my BDD. Another part of this is looking after yourself well. Getting basics right, getting your sleep pattern back to normal, getting your eating routines back to normal, trying to do some things which help your brain to get the impression that things might be okay. Garner some support, and of course remember that you're not alone. I'm hoping that some of you here with BD will connect with other people with BDD, and I'd really like it if some of you made a commitment or two to each other about how you might actually make some changes. A suggestion on, if you're interested in learning a little bit more about compassion, I don't have time today to go into this in detail, but Paul Gilbert's book, Compassionate Mind, is an excellent read. And compassionate mind training may not be enough to help people overcome BDD on its own, but it can be a really useful adjunct, and putting some perspective in your mind of trying to be kind, patient, loving. It can be really useful for some people to imagine what we call a perfect nurturer, a particular individual who, in your mind's eye, is looking out for you, is the kind of person that's got your best interests at heart, really likes you, really is warm to you, and imagining what they might want you to do, what things they might have to say to help you to confront your fears and cut back on rituals. Thinking of, as I said earlier on, finding a way of looking at your BDD can be really helpful. A lot of people find it helpful to think of BDD as a kind of bully. And I think that's a fantastic metaphor, because if you want a bully to stop bullying you, what have you got to do to it? Stand up to it. So your BDD says check, you say no. Your BDD says avoid, you say no. And in a way, in some ways that is the art of overcoming BDD, is understanding to turn it on its head. But other people find it helpful to think of BDD as a kind of imp of the mind, or a radio station that's kind of tuned to BDD FM. It's constantly telling you, oh God, they think you're ugly, oh, you look so disgusting, how can you bother to leave the house, it's really pointless unless you can get your appearance improved, nothing in life will be worth living. This kind of constant, like a propaganda station, pro-BDD. And another metaphor might be things like thinking of some of your BDD intrusive thoughts and unpleasant ideas as a bit like spam email. That you can't stop it from coming, but you can learn to filter it out. So you learn not to open up, you learn not to pay attention to it. Again, I'm curious, has anybody here ever had any other useful metaphors, any ways of thinking about their BDD that's helped them to maybe separate themselves from it and think about how they're going to stand up to it and tackle it? Anyone used the kind of bully idea before? So think, because it's about understanding that your BDD is not you. It's a bit like having a cold sore or the flu. It's a disorder. It's a thing that's happening to you. It's not your fault. You didn't invent it. So try and think of a way sometimes of separating it out from yourself and think about how you're going to tackle it. So cornerstone in starting off in cognitive therapy for any obsessional problem like body dysmorphic disorder is this concept of trying to redefine the problem. So theory A being that you assume that the problem is your appearance, and this means you end up avoiding, camouflaging, lots of safety behaviours, lots of time spent preoccupied, planning, preparing and so on. And how's that worked out for you? And could it be that it's worth considering theory B, that the problem is one of a preoccupation with your appearance? That it may have a very understandable context in terms of having been somehow brought up in an environment where appearance was made too important. It may be that you were bullied or teased or humiliated in some way. And trying to think, okay, so maybe this is a product of a psychological experience, and let's just see what happens by testing out, treating it as if it's a psychological problem. We're not expecting people with BDD to buy into the idea, oh, it's funny that I realise now I look fine, I've just got a problem with my head. Not the outside bit, the inside bit. We're saying, well, let's try and see it as an experiment. Let's see what happens if you treat it as if it's a psychological problem. One of the other ways in which I'm very keen for people to think about recovery from BDD is to think a bit about reclaiming yourself. So about becoming more of who you really are and less of this person that's pushed around and manipulated and bullied by your BDD. So something to think about is that as you've had BDD, have there been any aspects of your personality that over the years have been kind of whittled away, worn down, been neglected? No. Did you, once upon a time, used to be really curious, creative, generous, feeling like you had a great sense of humour, that you were kind of playful, perhaps you used to be the optimistic person in the room. And I know for some people it's very hard to think back to before BDD, because a lot of people have had it since early adolescence. But think about the times when maybe you do feel a little better, and those glimmers, those hints of maybe what your real personality is. And there's a little bit of evidence that shows that if you identify the strengths of your personality, the bits of you that you think are really rather useful, if you play to those strengths, if you come at any problem playing to your personal strengths, these neglected aspects of your personality, you may well solve the problem better. So think about CBT. The principles are going to be fairly generic, but the way in which you might do it might change. And if you're more playful, you might do a more playful kind of CBT. If you're very creative, you might do a more creative kind of CBT. If one of your strengths is being very honest, you might go around and tell a lot of people about BDD and really get it out there in the open. So do good CBT, but maybe think about doing it your way and think about inflating the un-BDD parts of your personality. And related to this is some stuff that we've taken from Acceptance and Commitment Therapy ACT, which is this idea of trying to follow your values, the kind of person that you really want to be about in this world. And not many people really set out in their life to be about the person who is stood in front of the mirror, scrutinising and checking their appearance. Underneath your BDD, even if it may be occupying many, many hours of the day, there is you. There is what you're really about, the person who should be pushing aside your BDD, breaking free from it. So what do you want to be about? What kind of person in this life do you want to be remembered for? How would you like to look back on your life on your deathbed? What kinds of things would you like to have achieved and to have done? How to focus your mind on the life that could exist outside of BDD. So think about the different dimensions that you might want to really pursue, to really commit to in your career, in intimate and romantic relationships, in the kind of parent you want to be, in education, in the kind of friend you want to be, the kind of family member that you want to be, what you might be about in terms of spirituality. It's interesting that in our sort of secular society, we've kind of downplayed the importance of spirituality, but what we're learning from some of the research in OCD is that it's actually a very important area of quality of life for people, and that many obsessions will interfere with people's ability to practice their faith in a way that really works for them. And this may be true for people with BDD too, because of course it's even difficult to get to church if you've got very severe BDD, because it's a challenging social situation. What kind of person, what kind of member of society do you want to be? How would you like to make an impact on the community? What do you want to be about more broadly in terms of looking after your physical health and fitness? And what are your loves in leisure and recreation? And it's worth starting to think about these things, identify the directions that you want to take, and make sure that they become your signposts, your magnetic north as you navigate your way through and out of BDD. Information is power. And one of the more important things to do if you're relatively new to the diagnosis of BDD or relatively new to the processes of overcoming it is read up. We do have some good self-help texts. There's that one called Overcoming Body Image Problems, including body dysmorphic disorder. I regret to this day that they wouldn't let me call it Overcoming Body Dysmorphic Disorder. And of course, Catherine Phillips' book, which is exceptional in terms of introducing people to BDD, the broken mirror. And the Adonis complex is very interesting if you're a man with more muscle dysmorphic type of concerns. Right, so thinking about the nature of BDD, thinking about BDD as a problem of trying too hard, starting to, again, to redefine it as a psychological problem. That if you have been bullied or teased in the past, it's very understandable that you might then work a little too hard to prevent further ridicule or rejection. And the avoidance of safe behaviours of camouflaging and criticising your appearance may be part of trying to either prevent ridicule or rejection or trying to prepare yourself for it. But maybe your brain's got a bit too focused on that. Maybe it's trying a bit too hard to solve that problem. Maybe some things are best left to chance. It can also be a problem of trying too hard to be sure how you look, reviewing in your mind's eye how you look in an image, looking in the mirror, photographs and so on. And the idea can be that if I know how I look, then I'll be able to adjust how I live and maybe understand my status in terms of attractiveness and stuff. And once I've worked that out, I can either adjust my lifestyle or I can get some cosmetic procedures done. But actually what happens is you never really get a sense of how you look, and what tends to happen is we know that people will then tend to err on the safe side and trust their ugly images more readily than they do the more positive images that sometimes they'll access. So trying to look just right, trying to have things just so, and feeling comfortable. BDD becomes this problem of making you feel very, very anxious, very ashamed, quite down and depressed, and then will get you chasing your own tail in terms of trying to avoid or make things feel safe in order to feel comfortable. But the trick is to get rid of the thing that's truly making you feel uncomfortable in the first place. So there's just a couple of examples of thinking about the ways in which the solution could be the problem. So for example, if you're spending time in your mind's eye thinking about how your face could be perfected, or certain scars or moles or something could be removed, if you're carrying out a kind of mental cosmetic procedure, all that's going to happen is your brain is going to focus on the gap between how you think you really look and that ideal self, and just increases dissatisfaction, increases preoccupation. If you're walking down the street being vigilant, you want to know how people are reacting to your appearance, and you're scanning to see whether people are laughing and so on, you will see people laugh. Sadly, that happens. You know, we know that kids standing on the bus stop will laugh, but they probably aren't laughing about you. But if you're looking for evidence to see how people react to you, you will tend to find a confirmation bias, and you'll see, if you go looking for trouble, you'll find it. And one of the other interesting things in BDD is it's not just a body image problem, it's very much a body sensory problem. And one of the things we know that people do in BDD is they will, even as they're walking outside, they will be tuning their attention into parts of their body to try and monitor and feel whether it's changing, getting worse. So if someone's focusing on whether their face is sagging, if you tune into trying to monitor whether your face is sagging, it's quite interesting. You can feel sensations that fit with that. So again, these things become more convincing. So this is just the tip of the iceberg in terms of the safety behaviours that, behavioural safety behaviours that people with BDD use. But this needs to be one of the first lists that you draw up. It's starting to pin down, if you're going to try and commit to treating this problem like it's a psychological problem, one of the first things you need to do is start to pin down what the psychological components are. And we don't mean by psychological that it's just stuff that's going on in your head, we mean the behaviours as well. So one of the things I'm going to invite you to do just now, if you have BDD, is just to try and identify 3 key behaviours that you think may be culprits in maintaining your BDD. It could be something you're doing to camouflage, it could be something you're doing to conceal, it could be a checking behaviour, it could be reassurance seeking, it could be planning, researching how you get your cosmetic procedures done. But just think of perhaps, if you were going to start today, what your top 3 hits are going to be in terms of behavioural tendencies that maintain your BDD. Behaviour is an interesting thing because it's the most accessible, the most easy place to start. And we're working on the assumption that if you change your behaviour, it will have an impact and influence other parts of your psychological system. But it is the most demonstrable and the most easily accessible part of that system. It's so exciting. One of the great things about hearing people share their experience about BDD, and we heard a couple of brilliant examples this morning already, is that sense of if you really want to know that you're not alone, it's those personal things you can really relate to. Something I've been researching recently a little bit is the more internal behaviours that people with BDD carry out. BDD, as you know, is defined as being a preoccupation with an imagined flaw in your appearance. And we've been curious as to, well, what does preoccupation really mean? I mean, it means that something's on your mind a lot, but what does that actually involve? It involves a lot. It involves things like focusing your attention upon yourself and monitoring your images and monitoring your body for any signs that give you information about your appearance. It involves lots of self-attacking, self-criticism. calling yourself. One of the things that we know that people tend to do here is that they will. It's a bit like kind of getting in first. It's almost like an inoculation. People with BDD sometimes think, if I am critical enough of myself, then there's not much that anybody else can say to me that will then catch me off guard and make me feel even more upset. So it's like a preparation. Does that resonate? The question is, if you were being sold that as a strategy for helping you, would you buy it now, given its consequences? Or has it now become something that maybe was an interesting idea or an attempt to solve, but would you rather quit that now? Ruminating and dwelling, chewing over the past. Rumination literally means, of course, it's taken from cows chewing the cud and regurgitating and ruminating, and the cyclical nature of us going over and over events in our minds. Why do I look like this? Why do people treat me that way? If only things had been different, if only I'd been born with a slightly different set of ears or eyes or teeth or nose or hair. And putting your brain in a really difficult position where you're sort of telling it that things could be better if only in a way that can't be changed. And that tends to be very important because it can lead to a lot of depression. Key compulsion, mental compulsion in BDD, as Catherine Phillips has already mentioned, is comparing. If you want to make yourself feel bad about pretty much anything, compare it against other people's thing. Salary, lifestyle, house, penis size, face, whatever. So again, trying to understand why people do this, and we understand that they're people are using comparing a lot. Again, a lot oftentimes as a sort of an assessment tool. Again, this idea of trying to work out exactly how I look, and if I can understand how I look compared to other people, that's somehow going to give me a better insight into where I stand in the scale of attractiveness and things. Already mentioned vigilance, scanning around in the world for any cues related to people thinking negatively about you and your appearance. Planning and preparing in your mind for going into social situations. Where am I going to sit? How close will I sit to people? What will the lighting be like? These kinds of things. Does that resonate? So again, you see this is preoccupation is a very active process. There's a lot going on. And people with BDD are trying to help themselves using these processes. But the question is whether these processes are really that effective. I don't know what the mental correction and was going to be. This is nature's way of telling you not to fiddle with your slides at night. I think it was going to be mental correction and mental cosmetic surgery. Again, this idea of thinking about how your appearance could be made different. Some people think that then I can, if I then get the chance to go tell a cosmetic surgeon how I want to look, I'll then have all the kind of ducks in a row and I'll be able to tell them. But again, all it does is tend to increase dissatisfaction. Thought suppression, trying to push thoughts out of your mind. And another important process is the extent to which we fuse thoughts with reality. One of the things we'll look at a little bit more is trying to regard thoughts and images as being a product of your mind, something you can detach from, rather than something that necessarily is portentous or is necessarily telling you anything real about the world or the way that you look. So again, I'm going to invite you, those of you that have BDD, to think about what your top 3 mental processes might be. What do you do in your mind? What resonates? What rings a bell? That you perhaps start to think about how you're going to identify those and begin to think about how you're going to change, cut back on those particular mental strategies. And again, importantly, you're not on your own. These are things that when we looked at, it wasn't a huge study, it was a study of 72 people with BDD. We thought that we would lose some of these items. We thought some of them would turn out not to be relevant in BDD, and they are all relevant, and they all link with symptom measures. So, you know, if you do it, trust me, lots and lots of other people with BDD do it too. Are there any CBT therapists in the audience? What's that? It's a vicious flower. Vicious flowers in CBT are important. They're a way of conceptualising. They're doing a way of doing formulation. Formulations are just a diagram, they're a sketch, they're a way, they're giving you a map, a theory about the maintenance of your problem. So it's worth, once you've started to identify some of your key behaviours and some of your key avoidance strategies and some of your mental behaviours, you start off by saying what the particular strategy is, such as avoidance, and then thinking along to, well, how does that backfire on me? What's the downside? How does it maybe feed back into my BDD? So it's really understanding that BDD is made up of a series of vicious circles. And it's just a visual way sometimes of just putting together all the different components that you're identifying that maintain your BDD and starting to pick them off for change. So the key thing is starting to question how helpful these strategies are. The avoidance behaviours, the safety behaviours, the mental strategies. Do they really deliver what they promise? Would you really teach these things to a friend? Would you teach all the scrutinising in the mirror? Would you teach the social avoidance? Would you teach all the camouflaging, concealing to a friend? Would you really advise that? Even if that person was worried about their appearance, would you really teach them this way of doing it? And if you wouldn't, why wouldn't you? What are the unintended consequences? What are the costs to it? So you're starting to focus on the costs and benefits of carrying out these strategies. To try and, again, Catherine mentioned motivational interviewing. Motivational interviewing is really a very beefed up version of costs and benefits, right? And it's about then trying to motivate yourself to change those particular strategies by really thinking through what are you hoping is going to happen by checking or by camouflaging, concealing or monitoring and so on, and what actually happens. What's the unintended consequence? What's the result? How well does it work? Another really simple tip, but in some ways a really obvious one, is to, once you've identified, so I'm hoping now you've got, for those of you that have got BDD, you've got at least 6 items in front of you, and starting to identify and record the frequency of these particular behaviours. So you can get some data back, and you actually see that maybe as you started to stand up to your BDD, your frequency of reassurance seeking is coming down, the frequency or the duration of your mirror checking is coming down. And it's important in another way. So seeing the results and change is nice, but actually for a lot of people, once they start to define the problem in behavioural or sort of thinking mental process terms and start to record the frequency, it starts to pin it down much more as a kind of project, much more as a psychological project, something you're going to really work to change. And it helps if you do this daily to keep it front and centre in your mind, that these are the targets for change. Your appearance doesn't have to change, but your checking does. Your appearance doesn't have to change, but your avoidance does. And it really puts that front and centre. And we use self-monitoring in research studies sometimes, and it's a real problem because sometimes simply by getting people to begin to identify and record their primary strategies, they start to change. Because you start to pin them down and start to operationalise them better. And one little tip, for if you've got a very frequent compulsion, say if you're asking for a lot of reassurance or you're doing a lot of mirror checking, get a tally counter, one of those things that you see train guards use or bouncers on club doors use to click, or Ben Affleck was using them in the Link adverts years ago. And just get something that gets you some real-world, real-time recording of the frequency of particular activity so you can really track it and really monitor it. One of the treatments we're seeing is becoming very much more popular within mainstream psychology at the moment is mindfulness training. I'd be cautious about recommending mindfulness as a standalone treatment for BDD. It probably isn't powerful enough. But one of the tricks that we can steal from them is this idea of detached observation. And it's important then again to have a way of thinking about this, to think about when a negative thought about that person is looking at me and they think I'm ugly. It's a way of trying to detach from that thought and imagining that it's more like traffic passing on the street, or it's a cloud passing in the sky, or a leaf floating down the river. And to practice, therefore, thinking, okay, what's happened is I've had a thought that that person thinks I'm ugly. So you're trying to defuse, you're trying to separate out thoughts from facts. Another key strategy is beginning to try and get, again, Catherine mentioned this, going deeper onto the beliefs. So trying to understand what maybe, if it's not, if your problem isn't necessarily about how you look, and it really isn't, then what else could be behind your BDD? Can you identify some important memories of bullying and teasing? I don't think it matters whether you necessarily were bullied or teased more than anybody else, or whether you are or aren't more sensitive. The key thing is, if what's got stuck in your mind, if your brain's reference point is particular bullying or teasing memories, and that's what it's drawing from in terms of generalising out conclusions about your appearance, your attractiveness, and how other people are going to respond to you, it can be really helpful to start to identify the meanings that those experiences have. So literally do 3 columns. What happened? What happened to you? What was said? What was done? What was the meaning? Draw a line down the piece of paper. What was the meaning that that had to you at the time? And then in the 3rd column, what's another way of understanding that experience? How could you reframe that experience? And another way that, again, I've been doing a little bit of research on is rescripting memories. And in your imagination, imagining going back in time, and if you've got a memory, for example, of a bully saying something particularly unkind to you, how you might imagine going back as an older, wiser adult and helping your younger self out, dealing with that bully, pushing them over, getting rid of them, taking your younger self out for a nice ice cream and a walk around the park. Rescripting, changing that memory so that the younger self feels better. Again, how many people here would say that they think that maybe some form, if you have BDD, some form of well, you know someone with BDD, some form of bullying or teasing was relevant perhaps in the background for you developing it? Okay. So again, we'd expect 60 or 70% of people to be able to pin that down to something that's and think, but question the idea of having dealt with it. Even if you've talked it through with a therapist in the past, just make sure you really have fundamentally changed that meaning and changed the effect of that memory. Sometimes just writing out a memory and rereading it a few times can help your brain to reprocess it and get a sense of that was then and this is now. Things are very different. That wasn't. Bullies don't bully for reasons of giving you truth. Bullies bully because they like to feel powerful. Here's a different strategy aimed at some of the interpretation biases that people with BDD sometimes have. So those of you that familiar with working with the therapists here that are familiar with working with OCD will be familiar with using pie charts to help to break up responsibility. Here's another way of trying to use a pie chart to help to question your interpretations. So a classic interpretation of BDD might be walking down the street, there's some kids at the bus stop laughing, and the thought pops into your head, those kids are laughing at me because of the way my nose looks so ridiculous. And that switches on all kinds of self-consciousness and brings out stronger images. So in the pie chart, you first of all rate how strongly do I believe that that's... So what happened was kids were laughing. Okay, so that's the event. Or it might be someone wasn't particularly nice to me at the supermarket. Or it might be the checkout girl wouldn't look me in the eye. What was the event? Describe the event that activated your BDD. And then write down how you first interpreted it. What conclusion did you jump to? Write how strongly you believe that to be true. And then start to brainstorm any other possible reasons for that particular occurrence. Why else might it be that the checkout girl didn't look at you in the eye and didn't smile? Why else might it be that the kids were laughing at the bus stop? By the way, why might it be that the kids are laughing at the bus stop? They're having fun. But they could be laughing at you because you happen to be the adult that's nearest by an adult by definition. Certainly in my family, in my home, I'm the figure of fun just because I'm old. You know, my kids have their friends around. I know they're rolling around laughing at me just because I'm older than them and a bit stupid. It isn't necessarily to do with any of the flaws that I'm concerned about my appearance, right? So it could be they're laughing at you, but not for the reasons you think that they're laughing at you. So you list off all the possible explanations for why this event might have occurred, and then you divide the pie chart up with these different explanations, and you put in the explanation that it's something to do with your appearance in last. And it's not about proving that people didn't laugh or they didn't change their behaviour because of your appearance, because you can't do that. You can't get access to someone else's thinking, so that's impossible. What it's about is getting out of that all or nothing thinking and starting to consider that there's a range of possibilities, softening up the conclusions a bit. It's well worth doing, and you can do it even in past experiences where you've taken things very personally, or even thinking forwards to future experiences where you're worried that you might take things personally. I'm not going to say much about attention training because there's a session on that later on today. I will tell you my favourite version of attention training, which is going for a walk. And my colleague Debbie over there will tell you that I'm quite often seen dashing out of the office with some patient of mine looking quite confused as to why on earth they're suddenly being dragged out of the office into the, well, hopefully into the sunshine, but let's face it, it's England, so quite often into the cold and wet. So my favourite version of attention training is the experience of just going for like a 10-minute walk every day, and first of all paying attention to the ground underneath your feet for a couple of minutes and noticing all of the undulations and stones and sticks and stuff that you pick up from underneath your feet, and then paying attention to the things that you can see around you, and then paying attention to all the different things you can hear around you for a couple of minutes, and then paying attention to the things you can smell, which sometimes is pleasant, sometimes it's not so pleasant. In North London it's often not so pleasant. And indeed things like the wind on your skin, the sun on your back. And what you're doing is you're training your brain to become more focused on the external world and getting more flexible in switching its attention. And what's striking about attention training techniques is your brain will fight like crazy not to do it. It will always want to come back on itself and think about what's going on and try to make meaning and draw conclusions. And so the real trick is to keep shepherding your attention back onto the outside world. And the idea is that you practice an attention training technique when you're not anxious and you're not feeling upset, so you get your attention muscles stronger, so that when you go into a more difficult social situation, for example, your ability to switch your attention away from yourself into the world around you is stronger, and it helps you feel less self-conscious. We can't avoid the fact that exposure and response prevention is still a core treatment in BDD. It's going to be still, for most people, the backbone, the fundamental. So we're hoping that if you get limber with your attention, if you get good at detaching from your thoughts, if you become more understanding of the mental processes that could get switched on in trigger situations, we're hoping that we can make the experience of facing your fears a little bit less painful. But nevertheless, if you listen to people who've recovered, it is going to be largely about confronting their fears and starting to cut back systematically on your rituals. So alongside the mental activities and the safety behaviours we've talked about, it's worth also adding to your list key areas of life that you avoid. Might be particular people, particular situations, particular kinds of lighting. It could be a myriad of social situations or trigger situations, but start to identify where you need to face up to and how you're going to go into those situations without your safety behaviours, without your camouflage, and ultimately face everything and recover. It's worth doing, as Catherine's already said, in a kind of graded and systematic way. You're going to probably have to practice this daily, but it is at the core. You know, if you can't overcome a fear of anything really without confronting and facing it. So also, let's assume that you've done great, gone great guns, you've really cut back on your safety behaviours, you've cut back in your avoidance, you're really starting to improve on your BDD. As you're running that process, it's important to start to fill the gaps, fill the void. So it says here that nature abhors a vacuum. You don't see Far Side cartoons like you used to. So this is about, as I was saying earlier on, it's a little bit about bringing back parts of your person and parts of your life. So guide your exposures a little bit. Guide the things you're going to confront somewhat by the people that you want to start seeing again, the places you want to start to go again, the activities that you haven't been able to do for a while, and how you can start to chase your hopes and dreams. So as your BDD reduces, stepping forwards into life and thinking about, brainstorm again, think about the people that you've not seen much of, or the people you only see under certain conditions, the places you haven't been to for a long time, or the places you'll only go to under certain conditions, and all the things you've been wanting to do that perhaps your BDD has been stopping you, and have a list of the things you want to get back. So bring back into your mind then the different aspects of your personality as you recover and things improve. Can you breathe more life into these other aspects of your personality, the neglected bits? What parts of life are you going to really throw yourself into, and how are you going to throw yourself into them? How are you going to bring your best game, the best sides of your personality to it? And similarly, guiding your next steps, using your valued directions, the kinds of ways in which you want to live, the kind of person you want to be. Now, this is not to say that I think people with BDD are insane. I want to be clear about this, but it's a great quote from Albert Einstein, the best definition of insanity ever heard of was doing the same thing over and over and again and expecting different results. And human beings, not people with BDD or anything else, human beings excel at this. We are brilliant at doing the same stuff and persistently doing the same stuff. If you tell a perfectionist that their perfectionism isn't working very well, their first thought is, how can I be a better perfectionist? Right? We are brilliant at it. His other great quote, wasn't it, was something like, two things are infinite, one is the universe and the other is human stupidity, and I'm not sure about the universe. And it's really important because changing your thinking and changing the way you live is a universal experience. We all have to shape up. This isn't just something that people with BDD have to do. But the right kind of CBT, again, as Catherine Phillips has shown, can really change people's lives. And ignore the people that tell you that BDD is just something you have to learn to live with. Ignore the people that tell you that you can't be helped. Pick some different strategies, attack those safety behaviours, attack those avoidances, really get your attention focused into the world around you, re-engage with life, and run it as a proper trial. Give yourself a chance to really see whether CBT for BDD can work for you. BDD is not your friend. It pretends that it's keeping you safe from harm. It really isn't. It's just like the worst bully that pretends to be your best mate, but is constantly stabbing you in the back. And my final thought really is that even when you're seeing, so people, one of the dilemmas is that we talk about having CBT and best practice CBT, then people worry that they can't get access to specialist services. My plea to you is to think about, even when you go and see the best specialists in the world, they're still going to give you homework, right? The bottom line is still going to be that it doesn't matter who it is in the chair that's opposite you, who your CBT therapist is, they're still going to basically tell you to go do it for yourself, right? It's always self-help. Real exposure is self-exposure. So please don't think just because you haven't got access right now to a specialist therapist that you can't do anything to overcome your BDD. I really passionately believe that you can. So please don't give up. Thank you very much.